Hi, I am Dr. Parul Shukla, pediatrician and neonatologist from Thane, practicing since the past 22 years. And today we are here to discuss the topic loose motions, or as we say, gastroenteritis. Now, when we use this term gastro, it means loose stools. That is, the child is passing loose stools frequently, and therefore it causes a matter of concern because you are losing salt and water and electrolytes through these loose motions, and therefore it is important that they need to be controlled immediately. In children, you may have various reasons. So we have viral causes of loose motion, which is most common. Bacterial causes, having eaten some stale food or anything from outside. So if you give the diet to the child as per the pediatrician's recommendation, that you start the weaning diet after the mother milk from 6 months of age and smoothly take the child through the process of weaning, there is no problem that the child undergoes a weaning issue. Bottle feeding should definitely be avoided because bottle feeding is the most common chance or the reason that the child has gastroenteritis, and that is the most harmful thing that you're going to give the baby, no matter what hygienic precautions you take. Having said and done that, let us look into the aspects of the dehydration. That is, what are you going to look for that your child is getting dehydrated. For a smaller infant, if the tears start looking less in quantity, the anterior frontal nail starts looking little dipped, the mouth looks dry, the tongue looks dry, it means dehydration has set in. Do not wait for the child's skin and all to get dry, because we are not in that era anymore, especially where the people who are looking into this video have this access to all the facilities. Should not wait for the time that the skin starts looking pinched and it takes time to go down. Do not wait until then. Urine output is another very important thing that the child should be monitored for. The number of times the child passes urine is about at least 6 to 7 times in 24 hours, and if anything which is less than that means that there is less fluid in the body and your child is in for a dehydration. Therefore, always look out for the urine output, which is the most important thing. If the child keeps vomiting, the priority is to stop the vomiting first. Now coming to the loose motions, the most challenging thing in the pediatric practice regarding loose motions is that they take time to recover. There is an infected state which is there, and thereafter there is this lactose intolerance which follows, whereby you lose the good enzymes and lactase. Therefore, that food or anything else is taken time to get digested and is passed out as it is, and therefore loose motions in children take time to get better. In children, loose motion should not be stopped forcefully by giving medications and anti-motility drugs that one dose given and the motions get better. That is not the way. Understand that the child does not require antibiotics to be given repeatedly or everyday antibiotic or change of antibiotic. Rather, we do not give the antibiotics initially unless and until we see gross pus in the stools and fever and abdominal pain and the child is sick. That is the only indication that antibiotic is given, and by the pediatricians. So do not self-medicate your child with antibiotics, and it is going to take time, and all this time you need to do is manage the dehydration. Do not allow the losses to continue. Replace it by giving ORS, that is the WHO ORS. So I hope this helps you in your managing the day-to-day issues of loose motions and diarrhea in children, and removes all the myths related to the diarrhea. Thank you very much.